This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today we're looking at a fascinating new study from the journal World Neurosurgery, published in 2026. The paper is titled Central Laminectomy, Contralateral Lumbar Decompression for Lumbar Degenerative Disease using Unilateral Biportal Endoscopy, a technical note and preliminary clinical results.
This is a timely topic, Alara. We've seen a massive shift toward minimally invasive spine surgery, or MIS, over the last decade. The goal is always the same. How do we achieve the same decompression as open surgery while minimizing damage to normal anatomical structures? Unilateral Biportal Endoscopy, or UBE, has really been at the forefront of that movement.
Exactly. And this study introduces a specific evolution of that technique. They're calling it CLCD-UBE, Central Laminectomy, Contralateral Lumbar Decompression. While UBE is already being increasingly adopted as a minimally invasive technique, this paper focuses on a novel surgical approach to handle lumbar degenerative disease.
Right. Now, for the residents listening, let's break down that terminology. Usually with UBE, we think of a unilateral approach to a unilateral problem, or perhaps a unilaminectomy for bilateral decompression. But here, the authors are emphasizing a central laminectomy via that biportal endoscopy route to facilitate contralateral decompression. Alara, what was the primary objective the authors set out to achieve with this technical note?
The purpose was twofold. First, they wanted to formally present the CLCD technique within the UBE framework, essentially providing a roadmap for the procedure. Second, they wanted to analyze the preliminary clinical results to see if the minimally invasive promise actually held up in practice for these patients.
It's interesting because when we talk about minimizing damage to normal anatomical structures, we're often talking about the multifidus muscle attachments and the integrity of the facet joints. In a traditional open laminectomy, you're stripping a lot of that away. With CLCD-UBE, they're trying to navigate that central work through those two small portals, one for the endoscopy and one for the instruments.
That's a key point, Dr. Aris. The biportal nature is what allows for that increased range of motion compared to uniportal systems. In this technical note, the authors describe how that freedom of movement allows them to perform a central laminectomy and then reach over to the contralateral side for decompression. They highlight that this specific technique, CLCD, is a novel way to address the degenerative changes that cause stenosis without the morbidity of a wide-open approach.
And let's talk about those preliminary clinical results. Whenever we see a technical note in World Neurosurgery, the focus is on the how-to, but the clinical data gives it teeth. While the abstract notes these are preliminary, the implication is that the CLCD-UBE approach successfully achieved the decompression goals for lumbar degenerative disease.
Yes, and for our listeners in training, it's important to note that the study presents this as a viable minimally invasive surgery. The authors are suggesting that the UBE platform is versatile enough to handle more than just simple discectomies. It can handle central and contralateral pathology through this specific CLCD maneuver.
It really highlights the learning curve for UBE as well. To perform a central laminectomy and then work contralaterally through an endoscopic U requires a high level of spatial awareness and mastery of the biportal triangulation. If you can minimize the bone resection to just the central and contralateral areas while preserving the ipsilateral architecture, you're really hitting that sweet spot of MIS.
Absolutely. The authors conclude that CLCD-UBE is an effective technique for lumbar degenerative disease. It provides a specialized way for decompression that aligns with the broader goals of modern neurosurgery, maximum effect with minimum disruption.
It's a great addition to the literature, especially as we move into this 2026 era where endoscopic spine surgery is becoming the standard of care rather than the exception. For the residents, I'd recommend looking at the technical illustrations in this paper to see exactly how they position those portals to achieve the central trajectory.
Definitely. It's a fascinating read for anyone looking to refine their endoscopic skills.
Well, that's all the time we have for this episode. Thank you for joining us on the Neurosurgery Hub podcast.
See you next time.